Today, Medbulletin presents new guidelines published for physicians treating patients with kidney stones. A new guideline for the surgical management of patients with kidney and/or ureteral stones has been released by the American Urologic Association. Chair of the panel, Dean Asimos, MD, worked with a team of kidney stone experts to develop one of the largest guidelines documents that the AUA has ever produced, highlighting more than 50 statements on best practices when treating patients with kidney and ureteral stones. The most pertinent change is that decision-making for treatment and therapy for patients with kidney and ureteral stones should be shared between physician and patient, said Asimos, chair of the University of Alabama at Birmingham's Department of Urology. Kidney stones affect more than 8.8% of the population in the United States, with direct and indirect treatment costs estimated to be several $billions per year, making it a common and costly disease. The guidelines provide instructions on the evaluation of patients with renal and/or ureteral stones and highlight the lab and imaging studies that should be used prior to intervention for such patients. The technical aspects of ureteroscopic removal of stones are addressed more extensively in the guidelines. The previous guidelines discussed medical expulsive therapy via the utilization of alpha blockers to facilitate the passage of stones in all segments of the ureter. However, the recent guidelines recommend this therapy only for stones in the distal ureter, which is located in the lower part of the kidney. Ureteroscopic removal of ureteral stones may potentially render a patient stone-free in one procedure. In this process, a ureteroscope is used to either extract an intact stone or break it up using a laser with subsequent removal of the generated fragments. The guidelines further discuss the use of stents in the ureter after a ureteroscopic procedure. In the past, there was a portfolio of guidelines for physicians discussing the prevention and treatment in various types of patients with kidney stones, Asimos said. Evidence has changed over time, prompting an update and the need for more comprehensive guidelines. The panel developed this set of guidelines based on evidence from past clinical trials and studies published in the peer-reviewed literature, as well as expert consensus of the physician panelists. This information is provided courtesy of the University of Alabama at Birmingham School of Medicine. Thank you for listening. This has been Paul Lukey reporting for Medbulletin on February 20th, 2018. Please check with us regularly on YouTube, Facebook, LinkedIn, and Twitter for interviews, discussion, articles, and editorial content on breaking news and topics of current interest in healthcare.